Thank you, dear students. Okay, once again, good morning to all. So, today our topic is pharmacology of prostaglandin. So, already you are familiar with prostaglandins regarding the introduction chapter, that is the classifications of autocytes. So, in this first slide, I am putting one image, that is myth and fact. Okay, so actually, the peoples are told the physical activity during the menstrual cycle or menstruation increases the menstrual cramps. It means, so those people, they're told like that, if you're doing exercise during the menstrual cycle or menstruation, certain muscles cramps or occurs. Okay, so that is the myth. They're told like, but actually fact is the physical activity, it can reduce the pain and bloating. So that is, bloating means nothing but that is the gas filling in the stomach or abdominal cavity. So that can be avoided, that can be treated if the females, so they are doing physical activities or light exercise or yoga pranayam during the menstrual cycle, so they are free from the pain and bloating. So this is the actually fact is the correct, but people are told like they do not do any exercise during the menstrual cycle, otherwise they are suffering from the menstrual cramps or pain. So can anyone justify why? From females, from female students, anyone, can you just justify what is the reason? So already I told to you during the introduction chapter. Okay, so already I told you. So whatever the prostaglandin, it can releases during after exercise, that is the beneficial. That is, it can shows the vasodilatation effect when prostaglandin releases after exercise, and that vasodilatation is helpful for to relieve the pain or to treat the pain. Okay, so what prostaglandin they can releases in our body after exercise, so that was having some beneficial effect. So due to that only, when you're doing the vigorous exercise, some body pain is present. After that, after bathing, so that can be relieved automatically without any medication. So that is the beneficial effect of prostaglandins. But also, so those prostaglandins, they are religious during the inactivity, so lack of physical activity, or sitting in a single place for longer duration. Okay, so that is a today, that is a COVID era, we having a lot of body pain, because that is also rule of prostaglandin. So whatever the prostaglandin that was releases during the inactivity of the person, so that prostaglandin, it can cause the pain due to vasoconstriction. So that's why our fact was correct, because here the exercise or physical activity, it can enhance the release of beneficial prostaglandins, then it can reduce the pain and bloating. But inactivity during the menstrual cycle, so that can cause vasoconstriction. So due to vasoconstriction, smooth muscles are contracted. Once again, we are suffering from the abdominal cramps, abdominal pain, or we are suffering from the fever, or we are suffering from the pain. So those women, so they are having the menstrual cycle or menstruation period. So that's why, so our suggestion is, so during the menstrual cycle period, you should be go for the light physical activity. Okay, that is the speed walking or aerobic exercise or yoga pranayam. So then we are free from the bloating, that is the gas filling in the abdominal cavity, as well as the pain. So pain is the common factor during the menstrual cycle. So that's why you can got the beneficial effect of prostaglandin by going through a physical activity. Okay, so now we learn regarding the introduction. So prostaglandins are lipid compound. So these are called eicosanoids. So prostaglandins are the group of eicosanoids. So others are thromboxane, leukotrienes, maybe bradykinin. But here prostaglandin, It is a lipid compound. So they are eicosanoids. So here eicos mean 20. In Greek, the eicosa mean a 20. It means the prostaglandin it can synthesized from the arachidonic acid. So this arachidonic acid consists of 20 carbon unsaturated fatty acids. It is made up of four double bond. So that's why the prostaglandins are known as the eicosanoids, because eicosa mean a 20, and this prostaglandin is derived from the arachidonic acid. So that arachidonic acid is consist of the 20 carbon unsaturated fatty acid and made up of the four double bond. So that's why the prostaglandins are the derivatives of eicosanoids. The eicosanoids means if any compounds belong to eicosanoids means so that compound will be having the 20 unsaturated carbon atoms or 20 carbon unsaturated fatty acids and consist of a four double bond. And the prostaglandins play important role in the inflammation, or it can regulate the inflammations. Okay, the process that inflammation may be harmful, may be beneficial, because the inflammation is required for the repairing of the damaged organ or repairing of the damaged tissue. So that is also the role of the prostaglandin. It is the main functions of the prostaglandin. Another function is it is contract the uterus. Okay, so in females, so due to that it can allow the labor, or it can regulate the ovulation or menstrual cycle or estrous cycles, because it is having the capability to contract the uterus. And here the prostaglandins are mainly four types, that is prostaglandin E2, also written as PGE2, prostacyclin I2 written as PGI2, then prostaglandin D2, it is written as PGD2, and prostaglandin F2 alpha, it is denoted as a PG2 alpha. Okay, so these are the derivatives or types of the prostaglandins. That is a PGE2, PGI2, PGD2, PGF2 alpha. And you remember should be that is the prostacyclin I2. It is one of the antiplatelet agent. So remaining prostaglandin they can cause the platelet aggregation, but a prostacyclin I2 or PGI2 it can shows the antiplatelet aggregation. Due to that it is helpful for the treatment of the deep vein thrombosis or cerebral thrombosis. That is nothing but it can treat the whatever the clot they can forms on the blood vessels of the brain or organs. So that clot was treated with the help of the injections of prostacyclin I2 or the derivatives of prostacyclin I2. You should be remember it is one of the potent antiplatelet agents. Okay, so prostaglandin in the stomach it can secreted from the mucous cells of fundus gland. So that secreted mucus it can forms the one layer around the stomach. So that layer was known as the mucus layer or potato layer. Its function is it can prevent the corrosion of the or damage of the membranes of the stomach, that of with the hydrochloric acid. Okay, so that's why the prostaglandin in the stomach it is play important role in the to avoid the ulcer, because it forms the one layer around the GIT mucosa or around the stomach inside. So due to that the acid cannot be touched with the membrane, and lack of touching, so there is no ulcer. If any drug, especially painkiller, so they are inhibit the prostaglandin, then can treat the pain and fever and inflammation. So that drug they can cause the peptic ulcer, because the potato layer cannot be formed. Okay, so that is the beneficial effect of the prostaglandin. It is acts as a or it is play important role in the formations of the potato layer around the stomach, GIT and large intestine. Due to that only we are free from the ulcer. If you are taken medications or certain food, if they are inhibit the prostaglandin means, So where only we are suffering from the ulcer, maybe duodenal ulcer, maybe colon ulcer, maybe stomach ulcers. Okay. So in the small intestine, it is synthesized from the or secreted from the crypts of lubricant, also known as intestinal gland and Burner gland. Both gland, they can secrete the mucus in small intestine, but in the stomach, that is the fundus gland, with the help of M cells or mucus cell, they can secrete the mucin or prostaglandin. Okay. So in the large intestine, so it is the large intestinal gland, they can secrete the prostaglandin along with the mucus. So that mucus can form the layer around GT. So that layer is acts as a protective layer. So this is the beneficial effect of the prostaglandin, but it is involved in the inflammation, and it is also helpful for to allow the birth, because it can causes the cervical ripening and as well as the uterine muscle contraction. So that both activity are helpful for to cause the labor, and also it can cause the follicular rupture. So due to that, it can cause the menstrual flow. So that is the role of the prostaglandins. So now we learn regarding the biosynthesis of prostaglandin. So when inflammation is occurs, or when any tissue injury occurs, or entry of allergen, so they can produce the certain allergens or cytokines. So those cytokines, so they can rupture the cell membrane, and cell membrane is made up of the phospholipid. So that phospholipid, in the presence of phospholipase A2 enzyme, it can convert into a arachidonic acid. So this is the basic molecule required for the biosynthesis of prostaglandin. And that arachidonic acid, it is consist of the 20 unsaturated fatty acid carbon and made up of the 4 double bonds, and it is synthesized from the membrane phospholipid by presence of membrane enzyme like a phospholipase A2. So this enzyme was activated when tissue was injury or cut, or entry of allergen or release of cytokines. Okay. So those are, they can activate the phospholipase A2. Then the phospholipase A2, it can convert phospholipids into arachidonic acid. And further, in the presence of cyclooxygenase 1 and cyclooxygenase 2 enzyme, they convert arachidonic acid into prostaglandin G2. And further, the prostaglandin G2 is differentiated into prostaglandin F2 alpha, prostaglandin I2, prostaglandin E2, prostaglandin D2, as well as thromboxane A2. And regarding prostaglandin F2 alpha, it is involved in the cause of the bronchoconstrictions and as well as uterine contraction. So due to bronchocontraction or constriction, it is involved in the cause of the asthma, and due to uterine contraction, it is helpful for the labor. Then as well as it can enhance the aqueous humor drainage from the eye. Okay, so this is the rule of the prostaglandin F2 2 alpha. Then PGI2, it is also known as prostacyclin. It can cause the vasodilatations. It means it can increase the size of blood vessels. So that is beneficial for to decrease the blood pressure, or it is helpful for the accumulations of the fluid at the site of the where the prostaglandin I2 can be act. So that is involved in the to cause of the inflammations. Then also it can maintain the patent ductus arterus. So it is the one type of the hole present in the hole in the heart. Okay. So in the womb, the child lungs do not work. Okay. So they are look like a sponge. They do not involved in the respiration in the fetus when the baby is in the mother womb. So on that time, so the blood that baby can got the oxygenated blood from the mother. So that blood is enter in the our heart in the left atrium from the here right atrium first. So from right atrium it can enter here, then enter to lungs, but lungs are cannot be work. So that's why, so one hole is present between right atrium and left atrium. So that hole is known as the patent ductus arterus. So that can allows the blood directly into the left atrium, from the left atrium to the left ventricle, from the left ventricle, that blood can enter in the, that is baby circulation, systemic circulations. But that blood cannot enter towards the that is the lungs, because the lungs are not properly work. So that presence of hole between the right atrium and left atrium, it can allows the entry of the mother blood directly into the systemic circulations or left atrium, with the help of the one hole that is present between the wall of the right atrium and left atrium. So that hole was known as the patent ductus arteriosus, and this hole is open due to release of prostaglandin I2. If any drug you are used in during the pregnancy, if that drug, if it is inhibit the prostaglandin I2, means so that hole was closed, then baby cannot be respirate. So due to lack of respiration, the death can be occur. So that's why during the pregnancy you do not use the medication. So that medication, it can inhibit the prostaglandin I2, and lack of prostaglandin I2, so that hole was closed, then the respirations was fail in the wombs. So that whole opening, that was maintained by the prostaglandin derivatives like a prostaglandin I2, and that hole was known as the patent ductus arteriosus. Then it is also inhibit the platelet aggregation, so that is helpful for treatment of the deep vein thrombosis or any blood clot in the blood vessels. Then it is also involved in the to enhance the pain sensitization. So due to that we are feel the pain. Then gastric cytoprotection, that is it is involved in the formations of the one potato layer around the stomach, and also it can inhibit the secretions of the gastric juice. And third analog, that is a PGE2, it can cause vasodilatations and decrease the gastric secretion, and also involved in the pain sensitization and uterine contraction and cervical ripping. So due to increase the size of cervical, so then only the baby can be came out from the mother. So that is the need of the cervical ripping or cervix ripping. So that cervical ripping was regulated by prostaglandin E2. So due to that, the prostaglandin E2 is helpful for the normal labor. If the prostaglandin E2 is not released or synthesized, so then only the doctor they can go for the surgery to ripening the cervical. So that's why you should be have the beneficial concentration of prostaglandin during the pregnancy. You go for the light walk or light exercise, or you can go for the yoga or any pranayam, so that can enhance the beneficial effects of the prostaglandin, and without any surgery the labor can be occurs. Then as well as it is also maintain the patent ductus arteriosus along with the prostaglandin I2. So that is helpful to allow the blood from right atrium to the directly into the left atriums, because in the womb the lungs cannot be work. So when the baby is birth, so after that baby exposed to the our temperature, our temperature, so then only the lungs are start to work. Okay, so within the womb, that baby lungs acts like a sponge, they do not involved in the respirations. So when birth is occurs, so when baby is came to our environment, so due to environmental change in temperature, so that lungs can start to work. That is known as the first breath after labor, or after baby can enter in the outside the body of the woman. Okay, so during that the blood can be recirculated with the help of the patent ductus arteriosus, and this PGE2 is also causes the bronchodilation. It is beneficial effect to avoid the asthma, and also it is involved in the cause of the pyrexia or fever. And regarding PGD2, it is involved in the cause of bronchoconstrictions like PG2 alpha. It means it is also involved in the cause of the asthma. Then sometime it is shows the vasodilatation, and sometime it can shows the vasoconstriction. It is having the mixed effect regarding vasodilatations and vasoconstriction. These are the derivatives and biosynthesis of the prostaglandin analog. And here some antagonists are there, so they can inhibit the prostaglandin. Examples are, Examples are glucocorticoids. So these are the steroidal hormone. So they are helpful for treatment of fever, especially inflammation, because they inhibit all the autocoids. So those are involved in the cause of the inflammation by enhancing the annexins one lipoproteins. So this lipoprotein, it can inhibit the phospholipase A2 enzyme, then the arachidonic acid is not formed, and lack of arachidonic acid, so these prostaglandin analog do not form. So that's why glucocorticoids are the strong anti-inflammatory agent, because it can inhibit the biosynthesis of the all autocoids. And second category drug, that is the non-steroidal anti-inflammatory drug like aspirin, paracetamol, indomethacin, diclofenac, ibuprofen, celecoxib, roxicopsid. So these all are our non-steroidal anti-inflammatory drugs. They are helpful for treatment of inflammation, fever, and as well as pain, because they also inhibit the autocoid. Those are involved in the inflammation, fever, and as well as the pain by inhibiting the COX-1 and COX-2 enzyme. So these two enzymes involved in the biosynthesis of the prostaglandins. Okay, so now we learn regarding the prostaglandin receptors. So the prostaglandin receptors, so they are mainly sub-classified into 8 types, and all prostaglandin receptors are G protein coupled receptor. Some are inhibitory, some are stimulatory. The first one is the prostaglandin DP1 receptor. It is denoted as DP1, and it is mainly present in the muscles, brain, and airways. In the muscles, once again, it is involved in the to release of the autocoids. So that is involved in the to cause of the inflammations. In the brain, so they can involved in the to cause of the vasodilatations or vasoconstriction. Okay, so due to that, so they are involved in the to cause of the migraine headache, and also so they are involved in the airways, that is the respiratory tract. So where they can cause the bronchoconstriction or bronchodilatations. So these are stimulatory receptor, because they can stimulate the G protein S. Then their mechanism is they can activate the adenyl cyclase. So due to activations of adenyl cyclase, more cyclic AMP was formed. So due to more cyclic AMP, the calcium can be raised. So due to that, it can cause the bronchoconstriction, muscle contraction, and as well as the in the brain vasoconstriction. It means so these prostaglandin receptors, so they are involved in the to cause of the headache or migraine or pain, and ligand is a PGD2. Then second, that is the prostaglandin DP2 receptor. It is denoted as DP2. It is also present in the muscles, brain, and airways. But it can inhibitory receptor, because it can activate the G protein inhibitory alpha subunit. Then it can inhibit the adenyl cyclase and decrease the cyclic AMP levels. And analog is once again PGD2. Then next third receptor, prostaglandin EP1 receptor. It is denoted as EP1. It is present in the platelet as well as VSMC, that is vascular smooth muscle cell, where it can cause the constriction. Then brain as well as kidney. In the kidney, so they having the beneficial effect. So they can enhance the glomerular filtration and enhance the excretions of water and sodium. So that is also, so they are involved in the regenerations of the kidney. If the drug like painkiller, so they are inhibit the prostaglandin, then they are involved in the cause of the nephrotoxicity. And here their mechanism is they can stimulate the phospholipase C, IP3, then phosphokinase C, then ERK P38 gene, then MAPK, and as well as the CRB. And analog is a PGE2. The next receptor, that is the prostaglandin EP2 receptor, that is denoted as the EP2. They are present in the platelets, then as well as VSMC, then brain and kidney. Then it is the stimulatory receptors. Then it can stimulate, mechanism is stimulate the adenyl cyclase and raise the cyclic MP, and stimulate the beta catenin, and as well as it can enhance the glycogen synthase kinase 3. Then analog is a PGE2. It means the prostaglandin involved in the accumulations of the glycogen, or it is involved in the regulations of the glucose through a prostaglandin EP2 receptor by enhancing the, so this enzyme that is glycogen synthase kinase 3. Then another receptor, that is prostaglandin EP3 receptor, that is it is denoted as EP3. Then it is present in the platelets, then VSMC, brain and kidney. It is having the inhibitor receptor because it can activate the G protein inhibitory subunit. Then it inhibits the adenyl cyclase, decrease cyclic AMP, stimulate phospholipase C, IP3 rise and the calcium. Then analog is a PGE2. Then prostaglandin EP4 receptor, denoted as EP4. They are also present in the platelets, then vascular smooth muscle cells, then brain, kidney. It is a stimulatory receptor. Then it can stimulate adenyl cyclase PK, that is protein kinase A, then PI3K, AKT, ERK. So these all are the enzymes. So they are having the different role. Okay, so then the analog is the PGE2. Then prostaglandin F2 alpha receptor is denoted as Fe. It is present in uterus, airways, then as well as VSMC, then eye. So in the eye, they can involve in the to enhance the aqueous drainage. In the uterus, they can cause the uterine contraction and cervical ripping. So that is helpful for the labor. Then it is can activate the protein, another protein, that is the GQ alpha subunit. They can stimulate, the mechanism is stimulate the PLC, IP3, PKC, raise the calcium. Then analog is the PGF2 alpha. Then last one, that is the prostacyclin receptor. So that is it is denoted as IP. It is present in the endothelium, that is the blood vessels. Then platelets, where it can inhibit the platelet aggregation. So remaining are they can enhance the platelet aggregation. So they are involved in the to clot. But so this prostaglandin, prostacyclin I2 receptor or PGI2 analog, so they are inhibit the platelet aggregation. That is the benefit. They are also present in the brain and kidney. Then it is stimulatory receptor. It can activate the G stimulatory alpha subunit. Then mechanism is stimulate the AC, that is adenyl cyclase. Then protein kinase A. Then raise the cyclic AMP. Analog is a prostaglandin I2. It means the prostaglandin receptor, they are found in the mast cells. So where they enhance the release of the autocytes further, or activations of the mast cell, then they can enhance the inflammation, or they enhance the pain, or they can enhance the fever. And the brain, so where they cause the vasoconstriction and vasodilatation. So due to that, the persons was suffering from the headache and pain, or even migraine. Then airways, so they can cause the vasoconstriction as well as the vasodilatations. In the vascular smooth muscle, so they cause the vasoconstriction or smooth muscle contraction. Then regarding kidney, so where they can enhance the glomerular filtration rate. So due to that, the excretions of sodium and water is increased. So that is also helpful for regenerations of the kidney or to control the blood pressure. Okay. So next regarding physiological rule. So prostaglandin, it is having the play important role in the gonadin secretion through a PGE2 analog. So this PGE2, it can send signal to the hypothalamus. Then hypothalamus, it can releases the GnRS from the hypothalamus. Then that can reaches to the enter pituitary gland. Then enter pituitary gland is involved in the secretion of FSH and LH. So like that, the prostaglandin is play important role in the regulations of the secondary sexual characters both in the male as well as the female through a release of GnRH by PGE2 analog. Then second role, the prostaglandin is also play important role in the regulations of ovulation, that is release of the ovum by, that is prostaglandin F2. It can induce the ovulation by causing the ovarian follicular rupture process. Okay, and prostaglandin is also regulate the luteolysis and menstrual flow through a analog, that is prostaglandin F2 alpha. So here the prostaglandin in the luteal cell then cause the depletions of ascorbic acid. So due to depletions of ascorbic acid, so these luteal cells will be ruptured or damaged. Then they can decrease the synthesis and secretions of the prostaglandin, and lack of prostaglandin, the menstrual flow can be occurs and it can avoid the pregnancy because the prostaglandin it can favor the pregnancy. So through a luteal cells or corpus luteum. Okay, so here the prostaglandin F2 alpha it can cause the luteal acid, that ruptures of the luteal cells or corpus luteum. Due to that, it can causes the menstrual flow or menstruation. On the if the menstrual flow is occurs means there is no fertilization can be occurs. Then next, the prostaglandin have also rule in the uterus. Okay, so in the pregnant woman, the prostaglandin I2 it can cause a contraction, so that is helpful for the laboring. Then as well as cervical ripening, that is increase the gap between the cervix bone. So that is the cervical ripening, and that is the role of the PGI2 that is helpful for the smooth labor. In the non-pregnant woman, the PG2 alpha and PGE2 they can cause the contraction. So the, okay. So next, the prostaglandin is also play important role to maintain the opening of the ductus artery. That is the role of PGI2 and PGE2. So that is helpful for the circulations in the womb or in the fetus. In the bronchial smooth muscle, they are contracted. That is PGF and PGD2. But PGE, it can relax the bronchial smooth muscles. Regarding GIT, where they can show the protection by formations of the protective layer and as well as they can inhibit the secretions. Regarding cardiac system, so the PGE2, so that can show the vasodilator effect, that is helpful for decrease the blood pressure, and PGI2 inhibit the platelet aggregation. It is helpful for to avoid the generations of thrombosis inside the blood vessels. Then PGD2 it can protect against the heart injury by activating the NRF2. It is one of the factor or protein. It can protect the heart by the damage due to chemical or due to overstretch or over contract. Okay. Next one is the renal. So here the PGE1, PGE2, PGI2 they have the role in the kidney. They can enhance the glomerular filtration and also so they can enhance the excretions of water and sodium. It is one of the beneficial effect to maintain the life of the kidney. If any drug they inhibit the prostaglandin means, so that drug can cause the nephrotoxicity. Example is a aceclofenac. It is a painkiller. It is highly cause the nephrotoxicity or kidney failure. So that's why unnecessarily you should not go for the aceclofenac as a painkiller. Otherwise your kidney was damaged or fail. Regarding the uses, that is the analog like misoprostol. It is the analog of PGE1. It is used in the treatment of the peptic ulcer. Then gemofrost, it is the analog of PGE1. It is used in the treatment of the terminations of pregnancy because they enhance the uterine contraction or cervical ripening, or simply they can cause the luteolysis or menstruation. Due to that, they can terminate the pregnancy if the pregnancy is not wanted. So that parent. So where they administer the gemofrost, that is PGE1 one, it can causes the terminations of pregnancy if the that womb cannot be required by the parents, or so that womb was unhealthy, it cannot be grow properly, then also doctor they can suggest you go for the terminations of pregnancy. That is the drug is a gemiprost or PGE1 alpha, not alpha, PG1 only, E1. Then gemofrost, then that is PGE1, then dinoprost PGF2 alpha, then dinoproston PGE2. They are given once again to induce the labor and terminations of the pregnancy. So these are the prostaglandin analog. So they are helpful for to induce the labor or to terminate the pregnancy. Due to only they can cause the uterine muscle contraction and cervical ripening. So that is helpful for inductions of labor. Or they can cause the luteolysis, that they can inhibit the prostaglandin by causing the damage of the corpus luteum cell. Then also they causes the follicular cell rupture. Due to that the menstrual flow is occurs. Then ovum is not available for the fertilization with the sperm. So that's why so they are helpful for the termination